Hi, this is Mary Greendale, and welcome to Just Thinking. Today I have Representative Carolyn Dykema with me, way down the other end of this conference table in the Select Board's meeting room. We're getting together for the first time, I think, since the whole COVID thing started. And I was curious what life's been like for a state legislator for the last 6 months, and how much of the time are you in Boston and not in Boston and so forth. So we're going to jump in with what would normally be a quarterly report, but it's really a little longer than that, and sort of a different kind of report, because really, have you guys been able to do anything?
Yeah, we have actually, Mary. We've just done it in a really different way. As you can imagine, COVID has required a lot of state government in terms of stepping in, whether it be for allocation of unemployment funds or, social safety net services, all of these executive orders and sort of the repercussions of that, and a lot of public questions that have come out of those orders inevitably come back to state government through the local representative. So, it's a lot more questions that I would say, or a lot more challenges, especially around unemployment, than we have seen before. So in a lot of ways, there's more work and more pressing and urgent, time-sensitive work than we normally have. But it is, interesting to see all of us have had to adapt really quickly. When you look and see how quickly the schools, for example, had to adapt to new schedules. The legislature was pretty much in the same position, where we had to figure out how we were going to continue to vote on some of these bills that were really important to COVID, to COVID response. And so we have a whole system of phone calling in. So we still have informal, sessions where we all have a dial-in phone number where we can vote, and then we have another phone number where we can call in so that if we want to testify or offer comments from the floor, the virtual floor, we can do that over the phone, and it's all secure. It's very clear who's on and who's not on the call, that kind of thing. So we've taken a number of votes. In fact, the end of our session, the end of our traditional session, which happens at the end of July, where we usually vote on, a wide range of legislation, we held that, and we voted on bills from a major climate response bill to a telehealth bill to a public safety reform bill, and we did it all by phone. So we're continuing to operate, although we do it primarily from home.
When you're doing it by phone, are you able to hear everybody else?
Mm-hmm. So what we do is we sit at our home office, just like many of us do, and we have our phone and we sit in front of the computer, so we can watch. All the legislative sessions are live streamed on the internet, so we can watch the session. There are a handful of people on the floor to kind of maintain decorum and keep the schedule, all wearing masks and social distance, obviously. So we can watch from the floor, and then we get the call or the text to say, okay, jump on, you're ready to have your floor time. And so we jump on, and it's broadcast out to everyone else when we testify.
How interesting. Now, do you debate? That's how you would actually carry on a debate? Yeah.
It's a little more challenging, I will say. It doesn't facilitate debate as well as in person, as nothing does really, but it worked. It worked with some fairly major contentious bills, which is a testament to the planning that's gone on to make sure that we continue to serve the people.
Do you suppose that it changed attitudes about, let's not waste time, let's just kind of really focus, because it was so focused? That's one of the things I find in doing these Zoom meetings and stuff. I did interviews of the town administrator. I found that a little bit challenging, because body language and that kind of thing often matter a lot to my interpretation of things in an interview. But when somebody's just talking about an issue like, Lowland Street or whatever, and you've just got their face, and you can get a lot of, you can read a whole lot of what's going on in their minds just from that. But it makes you really focus on their face. If I were sitting here and that person was talking, I'd be, looking at the ceiling or looking at somebody else in the room or whatever. Now I'm just focused on that person. It just changes it.
I will say, I think that overall, the system does not come close to an in-person. You know, when you think about what happens on the floor, normally when we're there debating in person, so much of what happens is not necessarily the person who's speaking on the floor who we can all hear, but we're also all interacting, right, and sharing information and asking each other questions. And so I think it's much more challenging for me.
Yeah.
It's the interplay with colleagues and that flow of communication, which has largely been replaced by phone calls. So you don't have this sort of serendipitous, you run into someone in the hall and you hear a piece of news that you might not otherwise have heard. Now you actually have to determine who you're going to call and reach out proactively. And so it's definitely not, in my opinion, as efficient and as comprehensive a system as it was. But again, nothing is these days, and we kind of do the best we can, and I think all things considered, we've done a pretty good job.
So how's the relationship between the House and the governor's office been during this time? I mean, obviously, I'm assuming that the senior officials are in the building so that they're perhaps continuing conversations, but how's that been going?
So it definitely is a different role for each of the branches. I will say, you know, the legislative process is by nature deliberative and it's not quick. You know, there's nothing you can do to get 200 people to come to consensus on something in a rapid period of time like you need this COVID response. So the governor has really taken on a much more leading role in the response, which the public can see because most of what we're seeing and hearing in the communities comes from an executive order that comes from the governor's office. The legislature is involved to the extent that legislation is needed to allow
Facilitate
any of these orders to happen, or if there are roadblocks, we would come in, and we can act pretty quickly when we need to. But we're involved in a more regular way through connections through, for example, the recovery task force, or the working group that the Baker administration established, that really convenes public health experts, medical experts, content matter experts to make sure that all of these executive orders that are issued are based in the science and the medicine around public health. And the legislature has representatives who participate in those conversations and report back to us. We have a House, actually the House and the Senate also has a working group, a COVID response recovery working group. So when we have a question, for example, we don't understand why an executive order was issued and was this considered, we work for the most part through our working groups, which are made up, in the House case, we've got a rep who has a background in disaster recovery. We have a couple of, one who's a nurse, one who's a doctor. So they are all interfacing on a very regular basis with the administration, and then we interface and send our questions to them. So it's, you know, we have a communication flow. I miss the personal contact.
Oh, yeah.
But we'll get there.
When will that be?
Yeah, I don't know. Not for a while.
So in general, what would you say the relationship, or how has the distance of the relationship between Washington and Massachusetts, how has that affected your work or your business?
You know, one of the things that we're very dependent on, obviously, is federal money. And the CARES Act money that came down early in the COVID response was essential to unemployment payments, to cities and towns' ability to do what they need to do, to the state budget and what we needed to do. And so to the extent that we're very dependent on federal funding, it has a huge impact. And we were expecting to have more federal funding by now, truthfully, because we still don't have a state budget. And the budget gap that we're looking at right now is estimated to be between $5 and $6 billion, roughly. And until we know what we're going to get for federal money, we won't know how much of that we can backfill. And so we can't build our state budget. So we had hoped, we normally would have a state budget by the end of July, by the beginning of July. We then did a 3-month budget to get us through 3 months. And now it's looking like we're probably going to have to do another interim budget until we have federal money, which is looking more likely not until after the election and potentially into the beginning of next year.
Yeah, that's just ugly. Now, besides money, one of the situations I watched Governor Baker's everyday kind of news conference when they were going on every day. And he would talk about how, the creative ways in which we were trying to get PPEs and creative ways in which he was trying to get the supplies, the basic
Right.
supplies that we needed and stuff. A lot of that, I think, got confounded because the president said, states, go ahead and just figure this out yourselves. Did that affect you guys? I mean, did you end up having to scurry around and either, quote, find money or act on things to enable that?
Yeah, I mean, absolutely. So, I mean, I'm getting calls, or Facebook posts from nurses saying, please get us masks. We're dealing with these patients and we don't have the equipment we need, which is, of course, heartbreaking,
Yeah, it's horrifying.
So we were all trying to figure out how to get this, and there was a very organized effort on the part of the administration working with the life sciences industry, and they created a sort of a triage system where they were reaching out to pretty much anyone and everyone. An example I give is, the marijuana industry uses a lot of this protective gear because they're, when they're growing, it's very contamination susceptible. So, we got equipment from them. We were literally, hunting and pecking for any mask that you could get. In fact, a lot of the community members stepped up and you started seeing a lot of people making handmade masks
Yep.
to fill that gap. There just wasn't the supply chain to fill the volume of equipment that was needed. And that's any piece of medical grade equipment that you could imagine, including ventilators and some of the more, equipment type. So a lot of the effort at the beginning, or one of the many efforts at the beginning, was to ramp up our local manufacturing capacity, recognizing that we were competing directly with everyone else, including other countries who were facing the same problem for these very precious protective resources. So wisely, I think in classic Massachusetts spirit, we said, well, we can do it ourselves.
Right.
So there were programs where we gave grants, and those programs are ongoing. And in fact, one recently came to Holliston, which is kind of exciting, which will be formally announced later, for anyone in the supply chain, for anything needed in COVID response to be able to ramp up. And in fact, there were even some clothing manufacturers, for example, who retrofitted their operations to be able to produce some of these needed supplies. So we really, a lot of the need was met that way. But to your point about the federal government, the federal government made no effort there's a federal stockpile, which is intended to go to states in times like this. And that stockpile was very closely held. It's still unclear how they were making decisions about who got stockpile equipment and who did not get stockpile equipment. And in fact, even in at least one case, and I think more than one case was in Milford, there was an order that the hospital made directly for equipment that was co-opted by the federal government, who decided that they needed it more and literally took it before it reached its destination. So it was this lack of coordination around kind of who's doing what, and it felt very kind of everybody for themselves type of mentality, which just, it was stressful enough, just to deal with what was coming, but now to think that we're competing, and even if you ordered equipment, it may not arrive, so you couldn't plan, made things just even more challenging.
Yeah, I think that's scary, actually. I know I heard an interview with some fabric or clothing company down in Fall River, and then there was one up in the Lowell area. So I'm assuming that those are the folks that kind of got those grants that you, okay. So now you said they're continuing. Are they kind of like continuing ad infinitum, or is it with the idea that these folks will, once this is all over and something, is this really ever going to be all over is my big question, but aside from that. So once this is all over, do they just go away so that supply chain is again broken? And if something were to repeat, that we got to go through this scramble again?
It's an excellent question, Mary, and I think right now we're really in still immediate response mode to be able to be thinking too much about that. But just given the conversations that we've had, and we've had Zoom calls with, a number of biotech companies who are involved in this, just talking about what is what does the future look like for a pandemic? People have been warning about pandemics for quite some time, and we didn't respond maybe as we might have.
Yeah, apparently.
But there's going to have to be a real conversation about making sure that if something, whether it's COVID response or some other type of pandemic, that we are able to control the supplies that we need to meet the needs of our own residents. So I think that will be an ongoing conversation.
But then that sort of gets into would it be, maybe you wouldn't, maybe you see something differently because you are at the state level, but wouldn't it be better to have that coordination come at a national level so that if we all need masks, okay? I can't imagine how it would work for a long period of time with everybody just dipping their hands into the same pot. I don't know.
When you look at the model for disaster response, as it's always been traditionally known, FEMA, for example,
right?
That is absolutely a federally coordinated
response,
effort,
thank you.
Right? And so you would think that for a pandemic, and in fact, there's an office within the federal government dedicated to pandemic response. I just don't think it was as robust, perhaps.
I thought they closed that down.
It was envisioned to be, but there really should be, and I think that was one of the frustrations, and I think we talked about this the last time we met around testing.
Yeah.
One of the real frustrations was that there was a recognition that testing was going to play a very important role in controlling the spread. And there was no federal game plan for testing. So there was very much a sense that, states were going to, local control, right? States were going to control their own destiny. And to the extent that maybe there was some interaction, the CDC had guidelines around testing. But in terms of providing access or ensuring adequate production and manufacture of supplies needed to meet that testing need, as far as I can tell, there was very little effort on the federal government in that regard.
In the way that the federal government has, or the president has the authority to demand that a factory shift production from X to Y, can the state do that kind of thing within its own boundaries or not? I don't know. I don't expect you to know that answer off the top of your head.
Yeah, no, I'll be honest with you. I don't know. During
just
a public health emergency, the governor has very broad powers.
Oh, then maybe that would.
Which is why all these orders are able to happen, which they wouldn't be able to
Normally,
happen
yeah.
under normal circumstances.
Right.
Whether that extends to private sector activity, I would say is probably a constitutional question, honestly.
Yeah.
But I would say, the framework, and I give a lot of credit to the governor for his approach, has been very cooperatively focused. So when you give, private sector companies an opportunity and the supports that they need to meet the need, my sense is that they want to meet the need, right?
Jump in.
Especially
Yep.
when a lot of their fundamental businesses are maybe compromised because
Sure.
of COVID.
Sure.
Here's a win-win, right? We
Yeah.
get the products we need, and
Yeah.
this company has a kind of a new mission and a way to keep people employed.
Yeah.
So that's a good story.
No, I was very interested to hear those stories because it demonstrated, both an entrepreneurial spirit, but also a cooperative spirit. And, right about now, I'm looking for cooperation anywhere I can see it, just to keep my anxiety levels down to something that I can deal with. So now, looking ahead, you're going to, you don't know about a budget. So what happens if you don't have a budget? You just keep doing the 3 months, or in our case, a 90-day or 60-day or whatever?
Yeah, I guess we're in unprecedented times. I don't know that anybody knows the answer to that question, and I think there's a great hope that the federal government will be able to send us the funds that are needed to meet, at least a significant portion of the need that we're seeing. If that doesn't happen, I don't know. I think we're all going to have to be making some really hard choices. We have a $3.5 billion rainy day fund at the state level, which has been built up from virtually nothing since the Great Recession. So that's a good news story.
Yeah.
But the magnitude of the need, not only in this fiscal year, but we're looking, these impacts are not going to end at the end of
Right.
this year. So we're going to have to be looking at, 2, 3, 4 years out to be responding to the needs that we're going to see coming out of this.
As far as the healthcare community, have they come into the State House? Have they, not maybe not literally, but have they been in touch with the State House about things that they need as they're going along, even whether it's the research end or the service provision?
Ongoing. And that's the center of gravity, if you will, is this recovery. It's not a task force, it's a recovery advisory, I think. I forget the name of it, but which is this, again, multi-stakeholder group that represents healthcare, medicine, the private sector, business. In fact, you can look on the website and see all of the people who are appointed to that commission, including Erin Ain, who is a Holliston native who was on that, was appointed by the governor to serve on that. So they're really kind of the great minds that are in charge of making sure that, the most important thing, which I think we in Massachusetts expect, is that all of this is science-based, right, and public health-based, and done methodically and thoughtfully. And that group has been reaching out, and I forget how many people and groups they've interviewed, but it's, hundreds and thousands of people they've had inform them of these decisions.
So this was the group that the governor set up that was, and then there was some complaint that one or two something or others hadn't, some cohorts had not been included or whatever. Yeah. Were they changed, or did it just stay like that?
If you can think about the number of groups that are impacted by COVID.
It was like 20, if I remember, he was talking like 27, 28 different little pieces, and they were all I thought it was a huge number, and that makes it really hard, but.
Well, I know, for example, the hockey rink owners were very, felt like they needed a bigger say into how some of these recreational orders were rolled out. And so just for, and that's just kind of the course of business, right? There's always somebody more that wants to weigh in, but the group has really bent over backwards to hear from as many people as they possibly can. And that group ended up, when it became clear that the schools and daycares had a very different set of challenges from the economy at large. There is also a group that's working on education-specific and childcare specific concerns.
So recently, I think I heard the governor, maybe yesterday or today, that encourage and go beyond just encouraging, but say, come on, communities where you have low risk, you need to get your kids back into school. Am I right that that's what it wasn't just
Yeah, I think there were 19 communities, I think they said.
So the selection being on the basis of numbers of cases, is that?
On the level of the risk level, the color coded, the green, yellow, red coding. So if you have a low risk level, the expectation is that you will get children back into the classroom. And this was has been a discussion for a long time now about, do you need to do that? Should you do that? Or should we stay with remote? And what we heard a lot from, obviously the health challenges are clear, right? You put people in a classroom together and you've got the potential for exposure. But I think what's less visible is what we were hearing about, increasing cases of child abuse from children being in their homes and not having any second set of eyes to see these children, the amount of stress and anxiety in these families, and having children exposed to that, the nutrition concerns. Food insecurity has gone up. We had a presentation from those that provide food to those in need in the communities, and the level of need shot up, by a factor of 3, almost overnight. So those children require, breakfast at school. That was the only way they were getting breakfast. So how do we replicate those programs if we don't physically bring? So I think, we're kind of feeling our way through this, but it seemed pretty clear that if you've got a low risk in your community, the reasons to keep kids out of school is much lesser, and you really should be trying to get them back in the classroom. Although teachers are still concerned. We know that the teachers are concerned about being back in the classroom as well.
So if a community goes from green to yellow and someday pops up red, are they supposed to then just stop school? Is that a sort of a preconceived?
I would say there's nothing about this that is nothing about any of this that is set in stone. And my new my new word for 2020 is flexibility, right? I mean, all of the rules that you always operated under are completely subject to change at any time. And I think that, the ground rules are just be as data driven and as fact driven as we can, and be ready to adapt. And, we've seen this with schools, that have expected to open with a hybrid model, for example, increase caseload or increase number of cases, and then they had to go back and end up starting with fully remote. And tremendous strain on the schools and administration and being able to be that adaptive that quickly.
Wasn't there the party in Dover or Sherburne had to delay opening for 2 weeks because there were some, crowd of kids, 150 kids.
And that wasn't the only school that had to do that. So
you have kids doing what kids will do, and then taking what has taken X amount of time to put into place, totally upending it, and leaving everybody going, ah, la, 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 la. It's terrible. It's terrible. So what do we do about the stress? Do they have special yoga sessions for you folks in the legislature? Again, online, of course.
Well, I do want to highlight, Mary, I did see on my Facebook page that Breezy Hill Farm does have goat yoga. So for anyone interested, I think, that certainly piqued my attention.
Oh, okay. I think Diana Phillips has done that down on her farm down on Norfolk Street, too.
I love that idea.
Yeah, seriously. Well, I don't think I'll be doing that, but okay.
But the mental health needs are
that's
significant. And we've, in Hopkinton, for example, later tonight, the Youth and Family Services is hosting a presentation on suicide prevention and identifying mental health concerns.
Yeah.
It's real.
Yeah. Yeah, for sure. I mean, even with my grandkids, Riley started school just in person yesterday. She's been online for a week. Now she's in school. Next week she'll be off. She'll be online again because they split the kids in half and just to try to keep the numbers smaller. But up until now, I mean, you want to say thirsty for companionship? Just, and at 14, it's really, I mean, the outer world is far more important than your family world at that point.
And their friends are
my God.
essential.
So it's been a real challenge for these kids. So kids that have limited supports, or maybe you're in a place where they just can't, in all seriousness, probably more than the city kids. In this case, I'd worry more about the rural kids. The kids who are tucked farther and farther apart from each other that really have little option. Do we have, or did we, I think we did have a food program that we were trying to do the breakfast and lunch. I don't know if I would have stopped it now, but we tried to do that here. I wonder if they tried, I'm sure they tried to do it in as many places as possible.
Anywhere where there was a need, it differed greatly community to community based on where the need was and what the need was. But most local communities really stepped up to help meet that need. And of course, like the Worcester Food Bank was an essential kind of organizer and convener and resource center for any of our cities and towns that needed help setting those up.
So now we're moving into the fall and the winter. Are there conversations about changing the models of some of the opening and managing of these things? Because it's not going to work, outdoor eating, okay, some are bringing in heat lamp things and all that kind of stuff. But I mean, just generally speaking, are there conversations about what is going to be suggested or recommended?
Yeah, we know that these working groups at the state level are doing work ongoing, right? And they're hearing about any concerns on the street pretty much immediately through their folks feeding into the process. But I will say I'm hearing from people that I know, friends that are teachers, they're struggling to find ways to group kids together. A lot of them are using outdoor settings to make that happen. Just for example, school pickup and drop off is a particularly challenging logistic. And a lot of times they set up places outside where they gather. What happens when it's raining? What happens when it's snowing? So it will pose a whole nother set of logistics challenges that aren't there today. So, to the extent that guidelines will be put forward. And I give a perfect example, like Halloween. I've had 2 people
Oh,
say,
gosh,
you know,
yes.
what's going on with Halloween? Are we gonna, you know, do we have it? Is it canceled? So I understand that the administration, the working group is putting together a set of guidelines for Halloween and kind of best practices,
Yeah.
recognizing that, you know, individual cities and towns are going to have some degree of influence based on their own local conditions.
It's funny because for safety reasons in the past decade or so, we've moved to having parties and gatherings for kids so that they aren't going around door to door.
Yeah.
And now it's going to be that it's probably safer to be going around door to door than to get into these gatherings. So that's a little ironic, but
Well, I saw one Facebook post, and I actually think it was in Mudville, that someone had set up a tube from their front door and it ran down their front railing with the idea that they could send the piece of candy down the tube and then the child, I thought that's brilliant. Now
That's
talk
cute.
about innovation.
that's cute. Well, besides that, you get all the kids lined up there, you know. It's like, it's my turn.
That's right. So as long as you've got 6 feet between them.
Yeah, that's cute. So anything else that you want the community, this community in particular, to know about what's going on with you guys up there?
So again, that, you know, we've got some major conference committee reports that are still being worked through. Like I said, we've got the major piece of climate legislation that would, among other things, commit Massachusetts to net zero by 2050 for carbon emissions. We've got, again, the public safety reform, telehealth, which, you know, what's been amazing to me is telehealth, you know, people were very concerned
Yep.
about opening up telehealth, you know, just, I don't even know in hindsight what the concerns were really, but
Right.
Clearly we had to move very quickly to a telehealth form of delivery for a lot of medical care that wasn't essential.
Yep.
And it's been overwhelmingly
Successful.
successful. I don't know whether you've had an
I have.
opportunity.
I
I had
have.
a couple and it was very efficient.
Yeah.
You know, you don't have to drive there, you don't have to park there, you don't.
Yeah.
So both the House and Senate have passed legislation that will facilitate and expand the just routine use of telehealth, which is going to be a great, you know, if we're looking for silver linings of
Yep. Yep.
of the COVID response, I think
Yep.
that's going to be one of them.
Yep.
And so all of these bills, particularly the public safety reform and climate, pretty urgent need to pass those before the end of this legislative session. And one thing I didn't mention is that we usually end our formal sessions at the end of July. Because of the uncertainty around this, we've extended our formal sessions indefinitely. So we are still technically in formal session, despite the fact that some of us are campaigning for office, which is very unusual. But I do expect that we will very likely vote on a climate piece, I hope, and the public safety piece before the end of the year, which means we'll be back with our remote, you know, telephone voting at least a couple times here in the future. And we're still passing, you know, routine bills, liquor licenses, local legislation. We've got a bill for Westboro that we're working on that just we finished in the House and just went to the Senate earlier this week.
Besides the telehealth, is there any other lesson that we've learned? Any other, you know, thing that we've figured out? I mean, I figured out myself that sometimes Zoom meetings are very, very good.
Yeah.
Because like the night that they had the select board had its meeting about Lowland Industrial Park. I mean, when do you get 100 and whatever people all in one, and where would we put them? Be hanging from the chandeliers, you know? So for that public input, this was a real benefit.
Yeah.
It's not the most efficient for some other kinds of activities, but that's certainly one takeaway for me. If you really want to do public input, you know how we say we want to do a planning project, but we need public input?
Yeah.
Do it on Zoom. You're going to get people at home much better than you're going to get them to come down here or they can't find babysitters or whatever. Or they're tired, you know, and they just don't want to go out.
Well, this is going to open up a question about, you know, town meeting.
Yep.
And I've had a couple of constituents who have been asking me for a long time. They want remote access to town meeting and to voting, remote voting to town meeting. And there's been, again, a lot of hesitation. I know the Moderators Association hasn't really loved that idea. There are some logistic concerns, but I think this COVID is going to bring that question really to the forefront. Especially, I think maybe walk before we can run. I'm thinking at a minimum, high-risk populations should be given an opportunity to access remote voting. So I'm actually thinking about filing something in that regard. We're still kind of scoping it out and talking to people, but I think that's the kind of thing that might leave a lasting legacy of this that's really helpful for people and expands access to democracy, much like the mail-in and the early voting have.
Yeah, I mean, that's an interesting one. I know that those communities that have elected representatives to town meeting can use Zoom or whatever. Obviously, we can't, just because you never know who's going to show up, so you can't. But I still think there's got to be a technical way that you can get around some of that stuff.
Absolutely. If there's a will, I'm sure we can figure it out.
Put their heads together and said, look, this is what we want to have happen. Let's see how we get there. So.
The other thing that I thought I would mention, because I know we've talked about it pretty extensively in the past, is transportation.
I was going to ask you about that, and it was like, oh my God, are they still going ahead with the one over in Alston or whatever?
The Alston multimodal.
Yeah.
Yes.
Yeah.
As of right now, they are, and I think that's a legacy project. That's not a 2-year project. That's a 10-year project.
Right.
That's a project that's going to serve for the next 75 years. In fact. So that is still going forward. The interesting dynamic here is that the commuter rail and transit, which were growing in use very dramatically over the last several years, and something I've spent a lot of time working on, use has dropped, especially in the commuter rail, just like a rock. And I think for communities like ours, which are suburban, where we've got a lot of commuters into the city, that the traffic on the Pike is, I think they said it was like 40% what it was pre-COVID. And I'm just not sure that's coming back. A lot of these employers are saying, to your earlier point, this remote work is really much more efficient than we ever thought it was, and we're going to keep it. And while there is always a need to have in-person meetings, maybe we'll have people come in 2 days a week instead of 5 days a week, or 1 day a week, So I think the whole question about public transit and who is it serving and what does it need to look like is really going to have to be revisited. And in fact, the T is in such dire financial situation as a result of the lack of funds coming in, that there's a new initiative called Forging Ahead that the T has just undertaken, where it's really going to look at our whole transit system, both the MBTA and the commuter rail, and align, knowing that there are going to have to be cuts and kind of reprioritization of some of these investments, aligning them with the populations as first priority that do not have alternative forms of transportation. So that would suggest on its face that there's going to be a lot more, or there's going to be a shifting of any funds that may have been directed toward commuter rail back to the core T system. And that's my concern for our residents out here. And going forward, the delegation from out this way is going to be very closely connected to those conversations to make sure that we are able to not only maintain the service that we have, but the service is going to need to change, because our schedules are very much oriented around this 9 to 5, right? You get a whole bunch of trains in the morning and then a whole bunch of trains in the afternoon. What they're already starting to do, and what I think will be the new normal, is all day service at regular intervals, because they're looking at commuter patterns and they're flattening, right? No one's tied to a schedule anymore. People are just kind of all day ebbing and flowing to where they need to go, and the transit will reflect that.
Sounds good to me, but anything to help the traffic situation.
Yeah. Well, traffic is great now. When I have gone into Boston, which is, as I mentioned, not too often these days, but I do have to go in every once in a while. Boy, it's best commute ever. My 2-hour commute just went to about 45 or 50 minutes.
Wow, that's a big
saved a lot of
improvement.
time.
Yeah, you picked up a whole chunk of life.
That's right.
Yeah. All right. Well, thank you again, Representative Dykema, for joining us. Keep me posted if anything exciting happens, and we need to get it out and get you in here. But in the meantime, we'll get back to you in another quarter of a year. Those quarters really go by quickly anyway.
I know,
but
they do.
This one was particularly dramatic.
Yeah.
So thanks, Carolyn, very much.
Well, thank you for having me, Mary. Appreciate it.
Okay, so I guess we can mull over what Carolyn's had to say. All kinds of interesting things going on. Let's hope that the next time that we get together in another quarter that we'll have a little bit, some good news somewhere, whatever. Vaccine maybe, who knows. All right, or maybe they'd even find a cure. That would even be better. Okay, thanks. I'll see you next time. And I am smiling under this, honest.